I'm from Providence, and I'm a Brown medical student. I just also wanted to say, I feel like I've been med school in part because I had an excellent public education. So I'm kind of grateful, very grateful to have had the sort of public option for education because my parents would not have been able to afford my private school. I've been hearing some people express concern about government interference, and that's a phrase that has come up a lot. And a few of those people who have asked questions related to that also have Medicare. And so I find that a little bit confusing because to me, Medicare seems like a public option for seniors. I know agree with me that we would like to see basically Medicare for all for our patients. So I was wondering if you could explain how Medicare, which a lot of people seem to be very satisfied with, compares to the public option.
Yeah, we don't want to live on Section 8.
Get a job. Medicare program is a single-payer public system. Rate established by the
Trying to get a job. Probably sit home and watch his TV on
it covers practically
195 bridge. They say they go out for jobs every day. Black eye. Sure go.
What we're trying to do is, with the public option, not to try to have a single payer.
Down the road for balance has a higher sign.
But ultimately, the public option, you have to make it on your own ability to attract customers by quality care, by program reimbursement.
I don't know.
Yeah, she forgot her hearing.
Reserve on
She stole some.
so, there's been a great debate going back to 1965,
I don't know.
whether we should have Medicare for all.
Very nice girl with you.
We'd like to be able to compensate sure that this mechanism we're talking about.
You still didn't tell us what you do for a living.
I can't tell you.
Private sector.
Secret Service.
Yeah.
And that's, I think, a considerable regret to a considerable number of Americans who like the security and the reliability and the efficiency of Medicare.
This guy.
But it's a very different model, as Jack has said. A, it's competitive, and B, it has to stand on its own feet with state insurance laws and stay solvent on its own state by state. So it is a very different model than Medicare. Much as we applaud Medicare and love Medicare, and if you're confused about some of the discussions you've heard, because some of the opponents are saying that the problem with healthcare reform is that it might interfere with Medicare. And obviously we want to protect Medicare. We're proud of Medicare. We think that it works very well. It just hasn't been adequately funded. This gentleman. Thank you, sir.
Hello?
Yes, it's on.
You know, Senators, I want to preface my question, my statement, in terms of common sense. In my profession, before we make changes to protocol that we've used for so long, what we do is we institute pilot programs. We evaluate the pilot programs. We disseminate the pilot programs. And after they've been instituted and they've been used, we look at them and we figure out where the worth of the pilot program was and actually if it will work. And we do that because in my business, if we don't, we can waste millions and millions of dollars. Now, I am unaware of any pilot programs that you've instituted. And what bothers me even more is I'm unaware of any thought process that's gone into the institution of a pilot program. Which leads me to my second point. Both of you senators have spoken about, I believe the number is $155 billion to $140 billion of impact to our health system by non-payment at our hospitals, which is stretching us thin. We all know that. We all know it needs to be changed. we all know that a huge portion of that is because of undocumented illegal aliens. All right? You can't believe it. Okay? Now, again, with common sense, I read a couple of articles recently that Roosevelt and Truman combined deported 20 million illegal aliens for the simple fact that they recognized the financial impact on the country. Is it that we don't have the technology that they had? We have no way of rounding up these illegal aliens and getting them out of here. You know, when American Airlines was in trouble, they walked through the cabin and they saw the excess magazines and they threw them out and they saved 30 million in fuel for excess waste. Why aren't we doing something about the illegal alien population, specifically as it impacts her and him in terms of health care? When we have an illegal alien that comes in, my wife works at the hospital. We've got to get at least one interpreter, maybe two. Now my child broke an ankle from a skiing accident, has to wait longer and longer, but the illegal alien takes precedent and walks out the door without a penny out of his pocket. How come you haven't done anything about that?
We tried.
Who paid for the meatballs?
And in fact,
Who bought the meatballs?
I'd like to hear his answer.
we tried, and in fact, Senator Kennedy was one of the leaders of the effort to do something about. I did ask if we could leave the microphones in the hands of the
I'll
public.
marry you. You could be on my help.
And it didn't work. We couldn't get the bill passed. Senator Schumer of New York has taken over as the head of the subcommittee of the Judiciary Committee that I serve on that deals with illegal immigration issues. And he is working on a new bill. I hope very much we can take action on illegal immigration. It is an important issue. But as freighted with issues as the health care reform bill already is, where we went with it was to say that nothing in the health care reform that we are adding will be eligible for illegal aliens. But to try to go further and solve the problem of illegal immigration on the back of the health reform bill is more, I think, that this bill can carry. So we just have to have to
Page
stand
50
by
of
on
the
that.
bill specifically states that no person residing in the United States, legal or otherwise, will be exempt from health care. Page 50, lines 14 to 27.
Okay, I'll take a look at it.
And what about
It's not in our bill. It's not in our bill.
pilot program?
The other point about the pilot program, I think is a good one. The bill that Senator Reid and I worked on actually is very heavy with authorization to the Secretary and the various agencies involved to conduct pilot programs.
So we will have a pilot program by the institution of the health care.
The health care bill creates the authority for the government to begin to undertake a lot of pilot programs in different areas. In quality,
Good if she was on a
in
motorcycle.
quality improvement, in prevention. No, but you need to give the government the authority to do it in order to have them proceed.
Move on to the next question, please.
Over here, sir. Sheldon, this young lady has a question.
This is going to be I think you're quite well, significant change. It is going to be phased in. For example, we have in our legislation, have given the state 2 years to establish the exchange. I would assume some states like Massachusetts are ready to go immediately. They already have a healthcare system which is universal, it's provided, etc. So I think we should learn a great deal from the first states that do this. And obviously, those lessons will be fed back into what we are going to do going forward. So the way this will be phased in is going to give us an opportunity to assess exactly what you're saying. How does this work? How can we make it work?
Let's do, we're getting to the end of the event, so I'm going to do Lillian right here in the white shirt, and then David.